Hello, we have so far done estimation of rate on an ECG. The next topic is finding out the rhythm. Rhythm, we know that it's very common. Either we've got atrial arrhythmias or ventricular arrhythmias, but the commonest one and the dangerous one are indeed the ventricular arrhythmias. So what I have here is an ECG. So take any strip of an ECG. Um, And if you see that this ECG has been recorded at the rate of 25 millimeters per second, the bold line, um, uh, after the bold line, we have small squares, and one small square is equal to 1 millimeters, and the distance between two bold lines is 5 millimeters. And so five of these will become are normally covered in 1 second. So take any strip of an ECG and take a QRS complex. In this one, we don't really have to worry about the board lines wherever the QRS complex is falling. But mark here where the P wave is and where the QRS complex is. And then drag it along the ECG at the other QRS complexes. Now what we can see is that P and the QRS complexes, they're all falling at same intervals. So this means that the P waves and the QRS complexes, this is sinus rhythm, and we don't have a delay between the atria and the ventricles, and this appears to be a normal rhythm ECG. We can also do another way, and that is we place a line here to one QRS complex and then place a line here at the next QRS complex, and then we just drag it along once again, and we see that the QRS complexes are equidistant, which means that this is a rhythmic ECG. So in this way, we can also do the same for the P waves as well. So if you can see, this is a P wave, and the line is falling on a P wave, and then there's another P wave, and then they're all equidistant. So this is an ECG, which is a rhythmic ECG. If the QRS complexes were not falling in according to this pattern, then it would mean that this is ventricular arrhythmia of one kind or another, whether it is initiated by the atria or ventricular arrhythmia on its own. Thank you.